So if you suspect your cat has a pleural effusion, you may have to decide, do I do more imaging just so that I'm more confident, or should I go in and drain the chest? And I think if you become more confident in your auscultation and you know that you can't hear breath sounds ventrally, you may want to consider just going in and draining the chest, doing thoracocentesis, because this can be life-saving for sure. If you would prefer to get more imaging, radiographs are always more difficult to obtain, at least quality radiographs, without causing further stress for the cat. You can sometimes just put the radiographic plate at the bottom of a cat carrier, put the cat in on top, as shown here, and sometimes you can get a good enough view to tell if there's free pleural fluid there or not. Pulmonary edema is very variable in pattern in cats with congestive failure. It can be, there's no one consistent pattern that you look out for, so it's easy to confuse with other conditions. Pleural effusions can obscure other structures within the chest, so sometimes they can be confusing on radiographs also. And it may be easier both to interpret and to obtain safely if you use ultrasound to have a look at the chest. And again, you can adopt a minimal restraint technique. Just put the probe on the cat's chest to get some idea of whether there's free pleural fluid present. So looking for an echolucent space around the heart, that can be enough to help give you the confidence to go on and do thoracocentesis. Here we can see tags of fibrin waving in the echolucent space of the pleural effusion. The other thing that's really helpful with ultrasound is to get a quick look to see if there's left atrial enlargement. And seeing a big left atrium as here, where the diameter of the left atrium is much wider than 1.5 times the diameter of the aorta, then that tells you that this cat has severe enough heart disease to be at risk of congestive failure. So if the cat is tachypnic, there's a very strong likelihood that you're dealing with congestive failure. So you can look at left atrial size on a short axis view or on a long axis view. On a long axis view, the left atrium should be less than about 16 millimeters. If it's greatly increased, again, that should increase your suspicion of congestive failure. And you can actually see pulmonary parenchymal changes with ultrasound as these long linear mobile artifacts, sometimes called comet tails. And this can be another way of identifying pulmonary parenchymal problems, such as due to pulmonary edema. If you suspect that your cat has pulmonary edema or congestive failure, if there's pleural effusion, you should drain it. If you suspect there's pulmonary edema, you should give furosemide to effect. If you can't gain intravenous access to start with, you can give the furosemide intramuscularly or subcutaneously to start with. Furosemide is still our first-line choice for diuresing a cat with signs of pulmonary edema. It acts within the first 20-30 minutes or so, and we usually give between 1 and 2 milligrams per kilogram as an initial dose, and repeat it every 30 to 60 minutes until we see a reduction in respiratory rate. We have to bear in mind that the treatment for relieving pulmonary edema is likely to worsen any signs of azotemia, and we also want to be aware of blood pressure before we start. That's not always possible, and our first priority is always to treat the life-threatening pulmonary edema. So irrespective of what the kidneys or blood pressure are doing, if you have a cat that you suspect has congestive heart failure, furosemide will still be the first choice. ACE inhibitors shouldn't be rushed into initially, and you may want to delay using ACE inhibitors until you've checked blood pressure and checked for azotemia. Sometimes people are anxious about giving diuretics in cats that may be hypotensive. We know that cardiac output increases as filling of the ventricle increases in the normal heart, but in the failing heart, that relationship is altered. And for cats with very high left atrial pressure, the higher the left atrial pressure, the higher the risk of pulmonary edema. Note that for cats that have very high pulmonary left atrial pressures and pulmonary edema, if you give furosemide and reduce left atrial pressure, you don't necessarily get the drop in cardiac output that you would see in a normal heart. So don't withhold furosemide because you're worried about the effects on blood pressure. If a cat has pulmonary edema, you need to give furosemide. Likewise, with blood pressure, you shouldn't withhold furosemide because you're worried about the effects on blood pressure. People sometimes want to give intravenous fluids because a cat may have a pre-renal azotemia, but IV fluids won't help with blood pressure if a cat is hypotensive because of heart disease. So as the left atrial pressures are reduced with furosemide, sometimes the change in output is minimal. So don't avoid giving furosemide for cats with hypotension, and you should definitely avoid giving intravenous fluids. If you can increase cardiac output, that will help reduce pulmonary edema, it will help increase blood pressure and reduce pre-renal azotemia, but it's quite hard to increase cardiac output in cats that have hypertrophic cardiomyopathy.